My topic for the case study presentation is epilepsy. First, I'm going to talk about a little bit about what epilepsy is and how it has relation to exercise, and then I'm going to go into my case study. So first, what is epilepsy? It's a disorder where nerve cell activity in the brain is interrupted, causing seizures. This cannot be cured, but treatment should help. And this may be caused because of genetics or brain injury, also due to other things. This does affect people of all ages. And in this picture down here, this just shows the abnormality of the brain cell activity. So a few more facts about epilepsy. It is one of the most common neurological diseases around the world, affecting approximately 50 million people. And 70% of the time, people do respond to the treatment. Fortunately, the other 30% they don't, but that is a good chance of responding to the treatment. So the main definition for seizures, since epilepsy causes them, is a brief episode of involuntary movement of a part of the body or the whole body. This causes loss of consciousness, loss of control of bowel or bladder function. This can cause higher rates of anxiety and depression. And many people with epilepsy are scared to work out because they have this false understanding of that they think exercise is going to cause them to have a seizure. So let's look at epilepsy and exercise. So first, the effects of exercise on epilepsy. It does reduce seizure frequency, it relieves anxiety and depression, reduces social isolation, and improves functional capacity, along with a few other things. Epilepsy does affect exercise, since people that are epileptic, they already are more dehydrated and are more tired than most people. So exercise causes them to be extra dehydrated and more tired. The people that want to exercise must tell people about their condition, and people must be aware about it at all times. Water activities are risky for people with epilepsy because if you were to have a seizure in the water, it's harder to save you than if you were outside of the water. And exercise may alter the levels of anti-epileptic medications in the blood. So diagnoses of epilepsy, you need to determine what type of seizures the person is having and what is causing it, because different seizures require different treatments. There are a few tests that I have listed here, and one of them is the epilepsy EEG test, and that test tracks electrical signals from the brain. Blood testing, there are various blood tests that you can get done, and many different ones that are recommended for your type of epilepsy. And then the PET scan, which is a position emission tomography scan, and this can be used to locate the part of the brain that is causing the seizures. And then the spinal tap, this is also known as a lumbar puncture, and it's a procedure in which the fluid surrounding the spinal cord, called the cerebral spinal fluid, is withdrawn through a needle and taken to the lab to be examined. And there are two different types of seizures. There are many types of seizures, but two different main types. The one is called generalized seizures, and that is caused by abnormal electrical impulses in the brain, and they typically occur with no warning at all. And then you have focal seizures, which are local or partial seizures caused by abnormal electrical activity in a specific or smaller part of the brain. And this picture down here just shows you a normal brain versus an epileptic brain, and you can clearly see the difference there. So some signs and symptoms. First, with the generalized seizures, those are the ones that you have loss of consciousness, you can lose awareness, stare blankly, body jerks, rhythmic jerky motions of arms and legs, stiffen muscles for around 20 seconds, muscle relaxation and loss of strength. And then for the focal seizures, you can have uncontrolled movement while remaining conscious, dreamlike state, you can be in a dreamlike state, and then also electrical abnormality spreads through the brain. All right, to manage epilepsy. Like I said before, it cannot be cured, but treatment is available. There is the ketogenic diet, which is one of the oldest treatments for epilepsy, and basically that is intended to maintain the starvation or fasting metabolism over a long period of time. Seizures often lessen or disappear during periods of fasting, so that is why this is one of the treatments. There's also biofeedback, and this method is using relaxation or imagery to change body functions such as breathing, heart rate, and blood pressure. So someone describes a stressful situation, and then you are taught different techniques on how to relax yourself better. And then there's also the vagus nerve stimulation, and this is surgery. And the vagus nerve stimulation is implanting a pacemaker-like device that generates pulses of electricity to stimulate the vagus nerve, which is that's what's being disrupted by the seizures. Down here, I have a link that lists a bunch of different treatments that you can check out. Other things about managing epilepsy that isn't as intense is basically just not overdoing it. You always have to make sure you stay hydrated, know your limits, and always consult with a doctor if you are planning on exercising. So now I will get into my case study, and here I have a 23-year-old male. His name is John. He weighs 170 pounds, and he suffers from epilepsy. He's a smoker, and his blood pressure is 140/80, so that causes him to be on beta blockers because he has hypertension. There's no family history. His LDLs are 80, and his HDLs are 45, which are kind of low, but not too bad, and he occasionally works out. So since he is epileptic, he is a smoker, and has hypertension and lower HDLs, this puts him at the high risk group. So his goal is to stay as active as he can and increase his endurance and muscles as much as he's able to. I definitely must keep an eye on his blood pressure during his exercise and make sure that he doesn't overwork himself. So for his exercise testing, first I made sure that he consulted with a doctor. He must stay on his beta blockers. We figured out that his max heart rate is 197, but I never expect him to get there because, first of all, he is on beta blockers, so that blunts his heart rate, and he's also has epilepsy. So his predicted VO2 max is probably around 38 to 42, and I decided to do the Bruce treadmill test to find out his VO2 max, but I know that I don't want him to get to his VO2 max because that's definitely too high. So I stopped him on the test when we got 60% of his VO2 max, which is 22.8. So along with all that information, I decided to do his exercise prescription this way. First, I have him warming up with just a basic 5-minute walk and 20 jumping jacks just to get his blood pumping more. So his main exercise for Monday, Wednesday, Friday is going to be mainly aerobic, and first I'm going to have him do some body weighted squats just to warm up his legs a little more, and then also do some lunges, and then on those days he's just going to jog at 60% of his VO2 max for 20 minutes, and then on Tuesdays and Thursdays he is going to do more resistance training. So I'm going to have him do 3 sets of 12 on the bench press, 3 sets of 12 on dumbbell flies. He's going to do 10 push-ups or as many as he can till fatigue, or close to fatigue, and then jump rope for 2 minutes, and at the end, towards the end, he's going to jog for only 50% of his VO2 max for 15 minutes because he did do that other resistance training. And then for cooling down every day, he's going to just end with walking for 5 minutes and then doing stretching throughout his whole entire body. So I have him doing this 5 days a week, and his intensity for aerobic is 60% of his VO2 max, and for resistance training is 70% of his 1 RM. So hopefully he works out for around 45 minutes to an hour, but I do have some substitutes for exercise in here, which there is more that he can do, but this is just a few things. So he can walk around outside if he's not feeling up to going to the gym or even doing any weights at all. And even if he just gets together with some friends and plays sports, that also will definitely help him. So in conclusion to all this, there is a lot of important things that I have learned throughout all of this, and having conditions and diseases is not easy when you want to be active. So you just have to make sure that you always consult with your doctor. You have to make sure you know what you have and what your risks are with having your condition. So with regards to that, exercise is definitely medicine, and that is something that we've been learning throughout this whole semester, and I continue to tell people that because it's definitely true. In most cases, like epilepsy, exercising definitely helps to reduce the risks of seizures. And that's it, and these are my references. So